The tragic death of Pauline Marking underscores a critical issue within the UK's National Health Service, NHS, the role and training of physician associates, PAs. This isn't merely a case of medical misdiagnosis. It's a stark warning about potential systemic failures impacting patient safety. Marking, experiencing excruciating stomach pain and vomiting blood-stained fluid, arrived at East Surrey Hospital in Redhill on February 16, 2023. Instead of receiving the urgent attention her severe abdominal distress warranted, she was misdiagnosed with a nosebleed and sent home by a physician associate, PA. 4 days later, she was dead. This devastating outcome prompted Surrey Assistant Coroner, Karen Henderson, to issue a Preventing Future Deaths report, a powerful indictment of the current system. Her concerns, laid bare in a letter to 12 key figures, including UK Health Secretary Wee Streeting and NHS England, are both profound and timely. Henderson highlights the limited training of PAs and the alarming lack of public awareness regarding their roles and limitations within the NHS. The report doesn't shy away from the core issue: a potential gap between the responsibilities assigned to PAs and their actual capabilities, leaving patients vulnerable to misdiagnosis and inadequate care. Marking's case isn't an isolated incident. It serves as a chilling illustration of a growing concern within the medical profession: the need for a comprehensive reassessment of PA roles and training within the NHS. The gravity of this situation is undeniable. The potential consequences of misdiagnosis, especially in cases of severe abdominal pain, can be fatal, as tragically demonstrated in Marking's case. The failure to recognize the seriousness of her condition led to a delay in appropriate treatment, a delay that ultimately cost her life. The coroner's report is not an attack on PAs themselves, but rather a call for improved oversight, enhanced training protocols, and increased transparency surrounding their roles. It's a plea for a system that prioritizes patient safety above all else. The government, responding to growing anxieties within the medical community, initiated a review of PA roles in the NHS in November 2023. However, the urgency of the situation demands more than just a review. It requires immediate, decisive action. The question isn't whether PAs have a valuable role to play in the NHS. They undoubtedly contribute to patient care, but rather how to ensure their roles are clearly defined, their training is rigorous and comprehensive, and their limitations are fully understood by both PAs themselves and the patients they serve. Marking's death should not be in vain. It should serve as a catalyst for systemic change, ensuring that no other patient suffers the same tragic fate due to inadequate training or unclear roles within the healthcare system. The NHS must prioritize clear protocols, robust supervision, and a comprehensive understanding of the roles and limitations of all healthcare professionals to safeguard patients and prevent future deaths. The urgent need for enhanced training and clearer guidelines cannot be overstated. The life of Pauline Marking demands nothing less.